Ready to go. Good morning. Good morning, everybody. I'd like to call the Door County Board of Supervisors meeting to order on Tuesday, January 26th at approximately 10:14 a.m. Would you please join me in a pledge of allegiance to the flag? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Roll call, please.
Present, and then Dale's present at District 7. We're not going to put District 7 in yet. We're going to leave her not present.
Okay. Bear with us. I'm trying to work across 3 screens of something I don't understand, but we'll get there. Okay, so we're all set?
Okay, yep, we're good. Sorry. Yeah, you're right. We're lacking this part.
Right.
So we have everybody present except District 7, which is currently vacant.
Got it. Okay, thank you. Presentation of the agenda.
Let's see, we can't.
Yeah, I can see it.
Oh, yes. Okay, sorry.
Right. Thank you. All in favor? Aye. Opposed? Correspondence? There was a number of items that.
You can't move your mic closer, and if he wants to talk, you have to push him in order to turn his mic on.
Okay, we'll try it. Is it a little better? Okay. Okay, does anybody have any additional correspondence they would like to add? Public comment. Does anybody from the public care to make a?
This hit me as a speaker.
Did you?
Just my face. Yeah. This hit. Okay, for those individuals that are either online or the called in, there is a way to provide public input. If you're on the phone, you can simply hit *3 and it will raise your hand and I can unmute you. Likewise, if you're on a computer system, there is a way you can actually select to raise your hand on the system. And again, I will unmute you so you can speak. So I'll ask 3 times if there's anyone who'd like to speak. I do have an individual who called in who would like to speak. They just hit *3. I have you unmuted. You have the floor and you have 3 minutes.
This is Dan Rorty from the Samuels Group. I am not able to get into the video portion of the conference. It's telling me the email address is wrong. I use both district@county or @co.door.wis.us, is wi.us, and with a space there. Neither one of them seem to work for me.
Okay, I will have Wayne follow up with you just to see if we can get
Thank
you in. If not, we'll have you. I know you as the call-in user. I can use you from there. Is there anyone else who would like to speak? I do have another call-in user. I have you unmuted. You have 3 minutes.
Good morning, Donald Fricks, 8305 Quarterline Road, Fish Creek, if this is me, and I hope
Yes,
you
it
can
is.
hear me.
Yes, we
Okay.
can.
Thanks, Mr. Pavic. Yeah, I'd like to make a clarification, I guess, updated to my correspondence on page 3. I have to do more research, but it's come to my understanding that Wisconsin governmental units already under state statutes can publish legal notices online, and maybe talking to our state representative and state senator could figure out a way that the county could save some tax money and not have to pay newspapers for printing legal notices at all. So it's my understanding governmental units already have the right to publish legal notices online. I don't know if that meets all the requirements. I think on page 2, I think the legislative committee should probably look at 18 U.S. Code sections 2383 to 2385 about conspiracy and to commit terrorism in relationship to our state senator Andre Jacques' January 5th letter to joining in on a January 5th letter to Vice President Pence asking for him to ignore his constitutional duty. Let's see. I'm looking at my notes here. Sorry. We've had. I'm questioning our state representative and state senators' priorities going into the new term here. So far, we've got 2 unfunded mandates being considered by Representative Kitchens. The first being the pollution credit trading bill, and second would be this newspaper bill funneling more money to local newspapers to print legal notices on their websites. I think to get everybody connected to the internet before we start giving more money to the newspapers. And on your broadband issue today, I'd like to just ask whichever committee is applicable, and I'll end here, that how, again, seeking to join with Door County Economic Development Corporation to further broadband in the county after that connection has failed so many times to do, to make it happen. Why we're even considering going there again. So thank you for listening, and thank you all for reading my correspondence this month.
Okay, thank you. For the second time, is there anyone else who'd like to speak? And for the last time, is there anyone else who'd like to speak? Okay, that concludes public comment.
All right, thank you.
All right. I just wanted to respond to and amplify the comment by the constituent about State Senator Jacques. So I know it's uncomfortable for some people to respond to this, but I think it's important to call out the big lie that Representative Jacques went so far as to write a letter to the former vice president asking to he asked him to interfere with a free and fair election and without any proof of it. And I think that another point is it's a slap in the face to the integrity of the election from this county and counties all across Wisconsin. So I don't think it's about a disagreement. I think it's a threat to democracy and one that led to a violent and treasonous insurrection. So I think we could go on record on behalf of the people that we trust with this election. And he's publicly saying they're liars, and I think it's dangerous. So I just wanted to say that I would support a resolution. Thank you.
More of a request for information. In reading over the information provided by the last caller and then going online and looking at the representative's information. First off, it looks like it's been passed already. If anybody happens to, does Ken, administrator, maybe have any idea in reference to the publications? And then the other question is just more information on it, because it does look, act, and feel like it's an effort to get payment for doing that purpose above what we normally saw. And it's muddied. I can't quite understand what it is. So I would be curious to understand it better if somebody happens to have information on it. So I guess I'm looking at the administrator.
I guess right now I'd have to work with Grant to do some research on what's being considered. I know we worked on this as a legislative issue about a year ago, just in terms of being allowed to publicize in other local newspapers, but I'm not aware of the current legislation that's being proposed.
Yeah, this looks like something on top of that. So that aspect has already gone through.
Yep.
It looks like a bill to provide compensation for something over and above what they normally would get compensation for doing the same job. And it is muddied, and I'm not sure that I agree with the caller's definition of what happened, but I'd like to understand it better. I couldn't find anything online to do that.
I can work with Grant and we can provide an update through our communication to you
It
on
could
that
even be
item.
done just by an email for that purposes, but further information would be useful. Thank you.
Bob?
Thank you, Mr. Chairman. I would echo Supervisor Ennigal's questions. I'd like a little more clarity on this issue, and I wonder, maybe Grant can speak to, I mean, can we publish legal notices on our website? We do run a county website, and we should be able to put them there. And so I guess I would recommend us doing that if that makes sense. And if we can, then does that relieve any other outlets, or do we still need to get, I guess, what's the legality about how, where we need to get it? Obviously, we want to get this as many places as possible. I'm just, again, looking for a little more clarity about what the constituent brought up, but I was curious if what are the issues with us getting it right on our own website? Thank you.
You wanna respond?
Not to be answered right now or necessarily, but.
I can answer in part. We are allowed to publish legal notices. And again, there are all kinds of legal notices that need to be published. So we're not talking about one overarching definition when you talk about legal notice. But certain legal notices we're able to publish on our website. It does not really relieve us of the obligation of publishing other legal notices that are required by specific statutes. And I would I guess I would comment that this doesn't directly impact the county in any significant way in terms of our publishing legal notices. There are legal notices that are required to be published when people initiate lawsuits, probate, general civil claims, other things. From the county standpoint, when we talk about legal notices, what we're primarily talking about is when we're required to publish legal notices of meetings or hearings. And that way, I think should be our relatively narrow focus, because in terms of the rest of it, again, to repeat myself, it doesn't directly impact the county, and we're talking about many, many, many different types of notices that might be required in very varying circumstances.
David?
Forgive me, because Grant brought up something that is always in the background of my head. I agree with his comments, but what I forget to say is, I'm not looking at just at the county level. I'm looking also at the town, village, city level of publications of documentation. The county is one thing, but all those rest of those municipalities fall underneath those same rules. Can be expensive for some of us. That's it. Thank you.
There we go. Technology. Approval of the minutes of December 15th, 2020 regular meeting. Have a motion and a second. Any changes, additions, deletions, remarks, grammatical errors, or other acts of omissions? If not, by voice vote. Okay. County Administrator.
Thank you. So on page 17, I guess I have the monthly report. There's a few things I'd like to go over a little bit more detail this month, just for the start of the year. I guess the first one is, obviously you'll see, I have included what it would be considered the projects that are going on in 2020. But then you also will see, I guess, projects that are, I guess, new for 2021. And those are just items that were, I guess, part of the budget, and I consider those special studies that we'll be tracking throughout the year. And then likewise, as part of the report, the county board requested that we provide the, I guess, the monthly rotation of the donations, and that's also part of the report, and we'll make that going forward for you. The one thing I guess I did want to discuss this really quick, and I'm going to defer part of it over to Grant, is on the bottom of page 17, as we're talking about the housing, section 980 for sexually violent persons. And maybe what I could do is I'm going to defer to Grant for 1 second, and then he can give an update for you.
briefly, we now have two individuals, so-called sexually violent persons that have been ordered to supervise release. The first order came about in mid-December. The second order came about in mid-January. From the point in time that the order for supervised release is entered, the county has 120 days to find an appropriate residential option for that person. So the clock began to tick on the first person, December 14th. So by mid-April, we'll need to have a residential option identified. For the second individual, the clock started to run roughly around January 15th. So by May 15th, we will have had to identify an appropriate residential option. And based on my understanding of, and my review of the cases, there's about 6 individuals that we would anticipate will be released in the coming years, or would be eligible for supervised release as they transition out of the inpatient detention treatment services.
Thank you, Grant. So,
Wait, oops. Susan?
Question, Grant. Who decides, let's say we put one of these manufactured homes in the spot that we're looking at, and has 2 bedrooms. Who decides whether one is to be a tenant in one and the other one has to be in a separate manufactured home, or whether they can room together? I mean, how does that get resolved?
There are various assessments done of the needs for these individuals. Again, they differ, and based on what their needs are, I should take a step back. The way this works, we have 120 days from when the person is ordered to supervise release to file a report with the court identifying an appropriate residential option. That report goes to the State Department of Health Services. They vet it and they forward a recommendation on to the court as to whether or not our recommendation is appropriate. Ultimately, to answer your question, Susan, the judge has the discretion to decide on a case-by-case basis where an individual subject to supervised release will be housed and what an appropriate residential option might be for that individual. As you rightly point out, there are some individuals that perhaps will not be able to live in a dwelling unit with another, but there are certainly individuals that will be released that can share a dwelling unit with another person on supervised release.
Thank you.
okay, thank you, Grant. Just one quick thing.
Wait.
Oh.
David?
Could we get Grant to give a little comparable? I think the people in the audience, as well as members of this board, might be thinking this is something substantially new from what's happening for the last 20 years. I give an example of the town of Egg Harbor having had a variation of one of those offenders looking to move into it. Is this basically, because it's recognized throughout the state that it's difficult to find places for these people that are getting released. That one did not work. It ended up going back to wherever. This is basically a variation of taking care of that issue, or is this different than that particular issue? Just so we can have comparables, so people aren't thinking this is some additional issue that they have from what they historically know over the last couple of years.
There's one way where it is significantly different, David. The circumstance you discussed occurred under the old rules where a sexually violent person ordered to supervise release could essentially be placed in any county in the state. The preference was obviously their home county, the county where the conviction arose. But what happened, and I'm being quite frank here, is we had 72 counties doing a version of Not in My Backyard. The state got sick of that, passed legislation in not too distant past that that said each county is responsible to find an appropriate residential option for those sexually violent persons that are serving sentences based on judgments of conviction that originated in your county, basically their county of residence, which not all the time, but most of the time is where the judgment of conviction came from. The State Department of Health Services is the entity that gets to decide
Bob?
Thank you, Mr. Chairman. Another question maybe for Grant. Is there a fixed amount of time that we will have to house these people, or will it vary depending on their certain sentence or whatever?
It will vary on their sentence. There is typically a minimum 1-year period where they have to be in the residential option. During that 1-year period, they are under house arrest with an electronic ankle bracelet. They cannot leave unless they're being supervised by a representative from the state. But it very well could end up being a placement for a number of years, but typically the 1 year is the minimum. They are subject to revocation, so if they violate the rules during that at any time, they can be placed back in secure detention.
Okay.
Okay, thank you, Grant. Just before I finish my report, this one reminder, these new mics are very, I guess, new as far as technology, so they're very sensitive in terms of your angle of voice and deflection. So again, when he turns on the mic, if you have the mic tilted up or further away, it's not going to pick you up. So you try it directly into the top and try to bring it closer to you so that way people can hear you and we can pick it up on the WebEx. Oops.
Alexis?
Thank you, Mr. Chairman. Mr. Administrator, I was wondering if you could provide a more detailed update on the 56 North 4th Ave. I see in your report that there are some meetings scheduled for this month, or were scheduled, I guess, and just wondering what the status of that is.
Sure, I was going to cover that for you.
Oh, thank you.
So I did want to cover just a few things, and that was one project. Since you brought it up, I will. As you remember, there is the project that's going on for the West Side School District, or the West Side School Project. That's the Community Development Block Grant dollars that we are trying to leverage to have that redeveloped. We finished a meeting last week with what we call the community, which is required for our community input. So that's the Citizen Advisory Committee. So, and we also had the prior week before that, we had a meeting to close out our loan fund. So in essence, right now we have completed closing out the fund. We have sent our money back to the state. That money is now being held by the state and they're waiting for our application. I'm hoping to complete that application this week. I need to have David sign away, I think like 30 different spots, just in terms of being able to submit the application. We'll hopefully have this in this week and we should be able to proceed from there. My guess would be is they're getting inundated with applications, but I'm guessing within about a month to 2 months, we'll have a response back on our application. In terms of this other quick updates, I just wanted to cover. One is just the redistricting. If you're not familiar, but every 10 years, we're required to redo the redistricting. So starting on page 19 is this information regarding to redistricting. In the past, we have formed a committee that would help go through that process. And our goal is to start bringing that forward next month. But what I wanted to do is at least introduce the concept. So that way you're familiar with it. And we will, I guess, provide more information and more detail as that moves forward. But again, it's just in your packet so that way you can get familiar with it. And again, that the timeline for this is we probably will start in February as far as our first resolution to the county board. But by I'd say June, July, you feel the timeline, we'll actually have the tentative plans drawn up by June. And then it goes through that process. So just wanted to give that to you so you can get familiar with it. We'll be bringing information next month to admin and then the county board to, I guess, initially start the process itself. This, the last update, is not written in here. I just want to give an update this from the finance committee. There was some discussions just in terms of the treasurer's office, in terms of our tax collection. Again, just because of the items in terms of the transition with Jay, new software, plus we got hit with staffing issues. We actually fell behind in terms of our collection. We did discuss at finance in terms of the importance of trying to stay on task. But we have, I guess, in essence, caught up. So right now we are actually on the current date in terms of our tax collection and entry. So I just wanted to provide an update on that, 'cause I know there's been supervisors who have gotten called on that issue. And again, the finance is aware of what items occurred. And they, we had, I guess, a thorough discussion on that, and we're moving forward from that standpoint. Then this, the last update with this, oops, sorry.
Grant?
When you're done, I'd like to say a brief word on the Forestville Mill Pond Dam and the lawsuit.
Oh, that's right. I
Yeah.
forgot to do that part. Why don't you do that right now?
Okay, briefly, as mentioned in Ken's update, we were served with a summons and complaint initiated by the Friends of Forestville Dam, Inc. and about 13 other plaintiffs. That was filed on January 18th, served on January 19th. I'm working with our comprehensive general liability insurance carrier to determine whether or not there's coverage, and we will doubtless be working with outside counsel. So as is the case with any lawsuit, just a reminder that we ought not be speaking about it publicly, and just refer any communications you get to my attention for now.
Thank you, Grant. I forgot that. Okay, I'd like then now just do a quick or a shortened version of our COVID update. I did talk with Dan. Dan's available if you have any questions, but Dan's kind of going to defer his time to Sue. I guess, Sue, I will unmute you. You have the floor if you want to provide an update, please.
Thank you, Ken. Good morning, everybody. COVID disease activity level remains very high across the state, including Door County. Our average number of new confirmed cases daily is about 15. This has been level for a couple of weeks, and we're doing full contact tracing. So everybody is excited about the vaccine. We are very hopeful, and it's looking like there's a light at the end of the tunnel. It's going to be a powerful tool in helping stop spread COVID. Let's remember that it's just that, it's one tool. And right now, especially, other tools we currently have are very important. They remain vital. It's going to take some time to roll out the vaccine. So the tools I'm talking about that we need to continue are the good pandemic behaviors, masking, distancing, hand washing, avoiding contact with others outside your household. And this is for the foreseeable future. Even after you are fully vaccinated, we need to all continue those behaviors. And here's the rationale. There's not enough information currently to say if or when it will be safe to stop recommending these strategies. We need to understand more about the protection that the vaccine will allow in real world conditions before that decision is made. And it's also going to depend on how many people get vaccinated and how the virus is spreading in communities. Also, we don't know yet whether getting a COVID-19 vaccine will prevent you from spreading the virus that causes it to other people, even if you don't get sick yourself. So there's some unknowns there, and we need to continue what we're doing, really important. So Door County Public Health, as you probably know, is partnering with Dan Kane, Door County Emergency Manager, at Door County EMS. Those folks are doing, the EMS staff are being the vaccinators at our drive-through clinics. And then the Door County Fire Chiefs Volunteer Coalition are providing a lot of volunteers to help us with the whole process. And we are doing drive-through clinics. We could simply not roll out any vaccine if it wasn't for the assistance of the folks I just mentioned. So huge thank you. Aside from our activities, Door County Medical Center is also administering vaccine at their own clinics, and we are very much in collaboration with them in conversation. Please understand, it does not matter where you get the vaccine. We really just encourage you to get it as soon as you are eligible and that the vaccine is available for you. There is another question that's come up is there is no out-of-pocket cost to anyone receiving the vaccine. Providers are allowed to bill insurances for an administration fee to cover their staff costs. As far as extended care facilities in our county, the nursing homes have a state program that matches them with a pharmacy partner. This is in process, and to date, all Door County nursing homes have received at least their first doses for staff and residents. The assisted living facilities are also partnered in a similar fashion with pharmacies, and they are just beginning to receive first doses of vaccine this week at their facilities. The state plan also includes that retail pharmacies will have the vaccine. To date, none of the local pharmacies have the vaccine yet. There's also some plans for mobile vaccination teams with the National Guard. This is not available yet, and it's going to begin very small scale. To see how much vaccine has been administered in our county, you can go to the state DHS COVID vaccine page, and it actually has a bar graph of how much vaccine was administered each day. For example, last Wednesday, there was 108 doses administered, and on Thursday, there was 117 doses administered. And I mention those days because those were days of our drive-through clinics. I'm just going to explain a little bit about the process quickly. Those of us who are vaccine providers need to use the vaccine as directed by the state. So the recipients currently eligible are healthcare providers, long-term care facility residents, police, fire, and as of beginning yesterday, those age 65 and over. This morning, the state released more information about next groups of those eligible, and those groups will be eligible beginning March 1st or possibly after, depending on vaccine supply. And it includes educators and some public-facing essential workers. And there is a news release and a statement going into more detail from the state. Another parameter, so we need to stick to those eligible when we administer vaccine. Another parameter that the state has around vaccine use is that it is intended, when they provide it to us, it is intended for all state residents. So I've heard concerns about whether someone from Kiwani might come here and get vaccine. They might, and we will administer it to them. The biggest sin in this whole vaccine endeavor is wasting doses, and that's certainly to be avoided. So planning around vaccine rollout is really challenging, and our news release yesterday does go into this. The major challenge is lack of vaccine supply from the state. So we order vaccine on a weekly basis to be completely used per their direction in the following week. We order vaccine based on how many doses we can provide physically in a block of time relative to our staffing ability. The plan we have is to safely, efficiently, equitably, and as quickly as possible provide vaccine to as many residents as possible. We are dependent on the state's ability to receive and distribute vaccine around to all the counties. When we do the weekly order for vaccine, we receive confirmation just days ahead of when it's delivered and when our clinics are scheduled. So we receive notice earlier that we will only receive about 30% of our requested vaccine allotment that we requested for this week. So this means our demand greatly exceeds our supply right now. Obviously, we will not be able to vaccinate everyone that is scheduled through the public health clinics this week. And again, yesterday's news release by Joe covers this. Lastly, I just want to mention that we are definitely planning to have drive-through clinics at sites in Northern Door and on Washington Island. We currently do not have dates or exact plans for this. Again, vaccine is just one of the tools in this pandemic, and we ask that everyone be patient. That concludes my update.
Can I ask you a question, Susan? David?
Thank you. First, Sue, I want to say that this has not been a very well understood activity for our entire nation or our world to deal with. So none of my comments are meant to be negative towards any of that aspect. What I'm looking to understand is the comment that we have a little different in our state, in our county compared to the rest of the counties, many of the other counties, is we have a lot of out-of-state people with second homes. Not that I don't personally believe they shouldn't get it, but is that controlled as well?
If they have a Door County address, they are here, they can receive vaccine. If they register on our scheduler for vaccine and they're giving an address out of state, we will reach out to them and discuss what the situation is. And, you know, technically, we are not allowed to provide them with vaccine if they don't have a Door County address. You know, I think we're going to just have to address that each case individually.
Yeah, and I have no issues with, you know, you guys clearly understand that that's your world, not mine. I mean, however you handle it is how you wish to handle it. My only real issue is related to the fact that we all saw this in the early part of the year where all of a sudden there are a lot more out-of-state plates in this county than we are used to seeing in March and April. Then the next question is, and correct any piece that I have wrong about this understanding, the intent of the vaccines is to basically, for lack of a better term, trick the body into producing the antibodies. Is that a reasonable, simple statement?
I don't know that I would have used those words, but it, you know, like any vaccine, it creates an immune response so that next time, if in real life you encounter the vaccine, your body, or excuse me, the disease, the virus, your body recognizes it and is ready to fight it off.
Okay, so that leads, my next question is, those people that know they already have the antibodies, what is the plus, minus, or neutral reason to get the vaccine?
Right. It is advised at this point, if you have had COVID disease, that you do get the vaccine. And here's why. The scientific thinking is that the vaccine will provide a longer term immunity than the experience of having the disease. Certainly, there's more study being done. You are not eligible for the vaccine if you are in your infectious period. But after that, you are.
Okay, then my last question, just to clarify a statement that you made earlier about insurances. If you are an individual that does not have insurance, they cannot turn you down. This would include the hospital, correct?
Correct. You have that absolutely right.
Thank you. I wanted to make sure other people that may listen to this understand that. Thank you.
Yeah. There have been a lot of questions around why does the hospital ask for insurance cards? And that's the answer. You know, they're billing insurances for that administration fee.
Elizabeth?
Is my mic, can you hear me okay? I have three questions. I'm going to ask all three at once, and then I'll just wait for your response. My first one is about the canceled county shots and the wait list. I've had many very concerned constituents who finally made it on the list. They were canceled yesterday for the shots on Thursday, Friday. The email they received just said they were on a wait list. They panicked and tried to get back onto the hospital wait list, which they stopped because they thought they were lined up for the other shot, so they canceled that one. So panic going back and forth. If they get bumped to the end, do they get bumped to the end? Or I know it's a sliding it's a 4-week interval where you've signed people up. So their questions are whether they're going to be bumped now to the end, or does the whole group slide over? Also, the prioritizing, I believe, should be by age. If people are bumped and there is a 65-year-old versus an 80 plus, I was hoping that there would be some priority for through our county and through the hospital to get the oldest people vaccinated first. Secondly, the technology has been very difficult for the elderly. I've been trying to navigate for my parents, and it's pretty tough even for me. Even just the chore of getting on a website or using an app, taking a picture of their card, healthcare card to get into, even to be able to register at the hospital to receive a callback. So I'm worried about that. And then lastly, another important tool is the testing stations. And I'm wondering if they're going to continue past this next month. And also by personal observation, I've seen the use of them being limited. Yesterday, or the last one we had on Monday was about only 20 people had come through by the noon hour. The messaging is that you need to have a symptom I believe the messaging should be, we have testing available. You've traveled, come through. If you're a teacher, come through. As many people as we can get through there on a weekly basis, it's a wonderful, quickly done service that I appreciate, but the signage has not been real clear on the north end either. And people, I don't even know, a lot of people I think in the community don't know it's available. And I would encourage that messaging to get people as much as possible. Thank you. I'll listen now.
You asked way more than 3 questions. I'm happy to answer some of those. I'm just going to make one statement, and then I'm going to turn it over to Joe Kresbach to talk about the scheduling. And after that, I'm going to ask Dan Kane to talk about the testing. So I just want to say the situation with the canceled appointments is very unfortunate. We're really sorry about inconveniencing anyone and are well aware of the disappointment this creates. No one is more upset about it than public health staff. I can assure you of that. As far as your comment about the insurance cards, that is the hospital. We are not asking for that, so they would need to address that concern. In our scheduling, we do allow for people just to call in and not to go online. And now I'm going to let Joe comment on the rest of your questions. Thanks, Joe.
Is this picking me up? Yep. Okay. In relation to the question about scheduling, to be honest, yesterday we were in a little bit of a scramble trying to figure out what to do and didn't have a concrete plan. This morning, we've kind of finalized that our intention is to move people backwards. That's a real challenge, and part of that is really our manpower to be able to do that. We have about 1,200 appointments scheduled for new folks. We will have to shift everyone. We are also putting in a request for more vaccine for next week, and we'll put in that request based on the number that we have scheduled for next week, in addition to those that we bumped this week. And then we'll have to react to that on Monday morning in terms of what we actually get in order to move people as we can. You did ask about the age thing. To be honest, to start with, that was a real challenge. And if I'm going to be honest, some of what we're getting from the state seems like it's changing fairly rapidly, and we're trying to adjust to that as quick as we can. So at the moment, we are doing it based on age, but as we go past those folks that we have scheduled, we'll continue to adjust our planning for that.
Susan?
I wondered if Sue might talk about what we heard at the Human Services Board, Health and Human Services Board a couple of weeks ago about the restrictedness of what county public health and even the hospital, the providers are able to do. I mean, it was explained and it surprised me how many restrictions are on you as to what you can do and how you can do it.
So sure, I wish I remembered better exactly what I said, Susan, but basically we have to agree to use the vaccine as per plan. And when we fill out the survey to ask how many doses we want, I have to sign my name on the line that says we will use it for only healthcare providers, 65 and over, police and fire, those groups that are included in the current plan. We also are asked to use the vaccine up within the week. We have been getting the Pfizer brand, and that is only can only be stored in our refrigerators for 120 hours from when it leaves the ultra cold hub. So when we get it, we have about 119 hours to use it up. So there's no question. We can't carry over vaccine week to week. And we certainly had enough people wanting and fitting in the categories that we never kept vaccine over week to week. I think that's all the parameters. I'm not sure if I'm forgetting something that you're thinking of.
Well, you had commented on if you do not follow these. I think Dr. Hayes made the comment that
sure
they would have loved to use their extra So you know what I'm asking?
I do, yes. And if we don't go by the state parameters, we risk losing our future vaccine privileges. And that would be really bad for this community if either ourselves or the hospital lost our vaccine privileges. And they're pretty darn serious about it. I got an email yesterday from the state COVID coordinator, and she said she'd been hearing about misuse of vaccine, and if we knew of any egregious use of vaccine, we needed to report it, and it's been taken seriously.
Thank you.
David?
That brings up two questions for me. First off, it is unfortunate that there are bad actors out there that appear to be misusing the vaccines, doing their own interests. I recognize that the state has given you a very narrow window of what you are allowed to do. My question then is, say, and this is hypothetical, one of my questions is, if you have a vaccine dosage set up that you run out of people, somebody does not show up, are you allowed to use that rather than wasting it on somebody else? And then the other question is, right now, as of Monday, 65-year-olds were added to that list. Say there's a 65-year-old that lives here but is out of the area, won't be back for 2 months, would like to come back and get it. Does that category, is there any evidence that it looks like the state might remove that category from availability? So in other words, Tuesday they were allowed and they're going to stay on that list forever, or is there a possibility that a month from now they might take 65-year-olds and older back off that list?
Yeah, I'll answer that your second question first. And the tier rollout plan adds a tier. It doesn't ever take away. So they're not going to pull that back. You know, for example, healthcare providers were the first ones eligible, and they will continue to be eligible. If there are people that didn't want the vaccine or didn't get it, they can sign up for it anytime. As far as can we give doses to others, as I said earlier, the real sin is wasting the vaccine. And there are situations where you have vaccine in vials at room temperature or drawn up, and you have to use them in X amount of hours. And yes, we can, and we have used vaccine, a handful or two of doses. I can't give you an exact count, actually, in those situations at the end of our clinics. And we try to prioritize, who is in the current eligibility, but past that, it's just do not waste the vaccine.
Thank you, and both to you and Dan, as always, helpful. Thank you for the helpful, useful information.
You bet. I wonder if Dan wants to explain the answer to the testing question and whether it's planned for further than March.
Certainly, Dan here. Good morning, everybody. Yeah, that has been looked at, or is being looked at right now, to answer the question. The testing numbers this week were certainly much lower than in past weeks. Couple of points on that. The first, I would say, from the messaging standpoint, I feel the messaging, at least the outreach, has been pretty strong with the testing sites. I've done press releases. I've been on multiple radio spots, giving dates, social media. It's been out there. We're using our digital highway signs to push people to testing sites. I feel like that's been pretty strong. Unfortunately, the point about changing the messaging around needing a symptom is outside of my control. That's something the National Guard requires, and through the state and things. So that's unfortunately outside of my control. But I'll make a point of this is not something unique to Door County, the testing numbers. This is a statewide issue. The National Guard is seeing this happen all across the state. And it started right after Christmas. We were going pretty strong there up until that point, and once Christmas hit, the National Guard deployment took a pause until early January. I think that, along with the new year and having a bit of a break there, got people out of the testing roll. We set up some new dates. Unfortunately, in January and February, we bump into another issue of having two federally recognized holidays, Martin Luther King and another one February 15th. And that screws up the flow. And I think that happened a lot this month, where you're 2 weeks removed from, or 3 weeks removed from the last time it was tested. Those tend to get forgotten about, especially with vaccine being rolled out. It's at the forefront of everybody's mind right now, where testing is kind of taking a back seat. I think the biggest thing we're going to look at this week is working with the hospital to determine, as the other biggest testing provider in the county, is this something that they want us to continue? That the amount of manpower and resources it takes to do this is not necessarily small. So it's probably worth a discussion this week on if it's worth continuing through March 8th. And seeing if the hospital would be fine just taking on the additional workload from this guard site, or if we want to keep that going. But those discussions will happen this week to make a determination on that.
Todd, sorry.
Just one quick comment and then a question. I received a call from an individual from the county who expressed some concern. Apparently, this person has a family member that works for the sheriff department, and the concern was over the fact that the inmates or the people that were residing in the jail were getting vaccines, and the sheriff's department had individuals helping administer the vaccines and had not yet gotten their vaccines yet. I said I would share that on the floor today, and I don't know if that was an anomaly. I'm sure under the rules and regulations of the state, there probably was some reason for that, but that was a concern that was expressed. Secondly, as it relates to capacity, Sue, we hear a lot about, obviously it sounds as though the controlling factor toward how quickly we can vaccinate is having the vaccine, but Sue, with your department and the other medical providers in the county, have you assessed an overall capacity? In other words, if vaccine supply wasn't an issue, how many can we administer in a day, in a week, and is it sufficient, or what is that capacity? Is there an assessment?
Yeah, we've had those discussions with the hospital, and they have a number of how many they feel they can administer in a week. At our clinics, we came up with the number for a weekly estimate of we could administer 740 doses per week at this time. Not to say that couldn't change, but we want to, that would be sustainable. That is a good question. I am really personally hoping that some of the other resources that I mentioned, like the retail pharmacies and the state mobile vaccination units, are up and running soon, and that the vaccine flow increases soon.
So is that number, Sue, is that the health department only, or is that in conjunction with the hospital? And
No, the 740 is Door County Public Health. I don't want to speak for the hospital.
Yeah. I just think it would be probably a wise collaborative effort to understand what we can do countywide. And obviously that leads to where the end might be and what the total county vaccine.
Yeah, we've had those discussions and, kind of scratched our heads over it and said, this is going to take a while. How can we make it go faster?
Yeah.
Can I jump in?
Yes, Joe.
Todd, I would like to follow up on Sue's response there. So countywide, we have had those conversations. We are talking with the hospital and all other medical providers, with the exception of the pharmacies, at least once a week, usually a couple times. So I don't want to speak for the hospital and say what their number is, but our number, that 720, is in addition to theirs per week. And so that's what we believe we could roll out. That will change over time. Part of that is we are currently using the emergency services staff, who, as we get to spring, will be busier and have less ability to help us out with some of those, which is also part of the reason that we were probably a little more aggressive than we should have been in terms of scheduling for the first 4 weeks, is that we have that staff available. So that capacity will change and flux, and we're trying to figure out ways to account for that in the coming months as well. So there's been a lot of conversation about this and planning in terms of how many people can we move through one lane of traffic at the site? How many staff do we need for that? All that is pretty well mapped out.
I think 740 is that's a good number. Just from a curiosity or just from an end game perspective, if for instance, the hospital was to do equal, that's 1,500 a week. Obviously, we know how many county residents we've got. You kind of get a feel for the end game, I guess.
Yep.
If it's provided, right?
Yeah, that's the big question, is when we can get the vaccine.
Can I just clarify? There's one thing on that though, is there's county residents, but there's also county addresses too. So if they have an address, so you can say the population is only 29,000, but depending on if they have an address and the number of homes that are in Dark County, that's the one thing we're grappling with, is that demand can be much higher than that. So you have to keep that in context as well.
Vinny?
Thank you. I had a question about same thing. If we or when we know, it would just be useful to kind of know, are people pre-registering even if their category is not up now, so we can kind of get a sense of how many would be the total? I know that will be a moving number, but just an estimate of what our total vaccination number is, because I see as spring coming, there'll be more people coming back to second residences. And I mean, I'm fully supportive of anyone who is in the county with the residents getting a vaccine. I think that's an important message because that's our community, whether it's year round or just for a couple months. So I think that's a really important part that I'd like to just see if we can get a handle on. And thank you so much for everything that you're doing, because it's an amazing feat and much appreciated.
Sure.
Thanks, Kitty. People are not pre-registering out of eligibility on our scheduler. I'm not sure how it's working at the hospital. To your point, yeah, if they are in Door County, we don't want them spreading COVID, so we would like to vaccinate people.
I just have a quick follow-up on that question, which is just again for future, to just keep the communication open if there are things that you need that we can provide as a county board and support, especially if it's additional personnel or resources to kind of get to a number that you feel good about, which this number sounds great, but as the population changes or the vaccine availability changes, I just want to be as supportive as we can. Thank you.
Thank you so much.
Anybody else?
Okay, this one last item is relates to this part of the report. And again, it got put towards the back, so I was hoping, I don't want to have it hidden, but on page 42 of the packet, I just want to draw the attention to that. And my main thing for that is, again, just as we have mentioned, there's a lot of variables in this, and this could change in any direction whatsoever in terms of how we have to ramp up. But what I did do is I asked Aaron to put together a cost related to his staff providing support through the rest of the year in terms of doing these vaccinations. And this is a worst case, but I just want to put a number that we have to work through it. But in a worst case scenario, you're looking at about $133,000 of additional time on there, and just for the administration of shots from ES. I know Joe right now is also trying to ramp up and get more additional nurses just to also help with vaccinations. But I just want to make sure that the county board is aware that there's obviously a cost for this and a cost for us to do this, and we'll continue to bring that forward. But again, I just want to give you a heads up right now that, I mean, obviously we have to provide the ability to ramp up and provide the doses as they come in, but there's the human factor in terms of resources that we're throwing at it to make this all happen. And there's costs for that. So I just want to make sure that you're aware that that's actually occurring. And that'd be it for our update.
Okay, thank you. Any business resolutions? Resolution 2021-01. Recognizing Supervisor Aaron Tauscher in service to the county board.
I think it hit the paper.
Resolution 2021-01, recognizing Supervisor Aaron Tauscher in service to the county board. The Door County Board of Supervisors, whereas Aaron Tauscher was duly elected to the Door County Board of Supervisors in April 2020 and served through December 20th of 2020. And whereas Supervisor Tauscher represented District 7, encompassing the city of Sturgeon Bay, Wards 1 and 2. And whereas Supervisor Tauscher served on several committees and boards, including Legislative, Technology Services, County Ambassador, Health and Human Services, Sister City Informal Advisory Group, and the Sustainability Committee. And whereas Supervisor Tauscher also served as chairperson of the Aging and Disability Resource Center Advisory Board. Now therefore be it resolved that the County Board of Supervisors assembled this 26th day of January 2021 extends to Erin Tauscher our sincere thanks and appreciation for her service to the people of Door County and wish her the best in her future endeavors. Here. By voice vote. It's got to be the paper hit the screen. Okay. Resolution 2021-02, appointment to fill the vacancy in Supervisor District 7. I'll go through the process first before we go through the resolution. Whenever there's a vacancy, the current policy by statute is that the county board chair takes requests for potential candidates of people who want to fill the position. And then after we receive those letters or asks to be included, to be appointed, the vice chair and the chairman hold interviews. Susan and I did that a couple of weeks ago, several weeks ago now. And we had 4 candidates that we interviewed. There was a 5th who withdrew. So we interviewed the 4 candidates, and based on those 4 candidates, we then made our selection, and that selection is what I then went through the appointment and appointed her for the county board approval, and that is Morgan Rusnick, which is based on the resolution. So I will read the resolution. To the Door County Board of Supervisors, whereas there is a vacancy on the Door County Board of Supervisors for District 7, and whereas appointment of a successor is to be made by the Door County Board chairperson with the approval of the county board. Now therefore be it resolved that the Door County Board of Supervisors does hereby approve the appointment of Morgan Rusnick as County Board Supervisor for District 7 for the term ending April 18th, 2022. We have a motion and a second by voice vote. All in favor? Aye. Opposed? Carried. Thank you. Yes.
Share it. Okay, raise your right hand. I, Morgan Rusnick, who have been appointed to the office of County Board Supervisor for District 7.
Who has been appointed to the office of County Board Supervisor District 7.
In and for the County of Door.
And in for the County of Door.
In said county.
Inside county.
But have not yet entered upon the duties thereof.
But have not yet entered upon the duties thereof.
Swear that I will support the Constitution of the United States.
Swear that I will support the Constitution of the United States.
And the Constitution of the State of Wisconsin.
And the Constitution of the State of Wisconsin.
And will faithfully discharge the duties of said office to the best of my ability.
And will faithfully discharge the duties of said office to the best of my ability.
So help me God.
So help me God.
All right. Thank you. All set. I'll check you in.
Resolution 2021-03, appointments to committees, commissions, and boards. Something going on.
Yep.
Question or comments? If not, by voice vote. All in favor? Okay, we're going to jump down the agenda to resolution 20-21-14. the county facility in Washington Island project authorization to proceed with phase 2.
I guess what we'd like to do, if you could go to page 77, I believe, of your packet. I think we'll start there. I will share the screen so individuals can see as well. Hold behind it.
It starts on 73.
Oh, it starts on, well, okay, let me take a step back before I turn it over to Dan. So where we are with the for technology, we'll get there. So just where we are right now is this is one of our checkpoints. Remember, when we do large capital projects, we have a series of checkpoints for it to come to county board for review before it goes on to the next point. So obviously we authorized acquiring the property, which we have. We acquired bringing on an architect to do the design work, which we have. So now the architect has completed the initial draft. It is now, we're at the checkpoint of actually taking those drawings and going out for bid. So what's before you today is the resolution to do that. It starts on page 73, along with the, I guess, the report and then the drawings. Well, there's the budget on page 76, just so we're tracking the budget for the project all the way through. And then on page 77 would be the, I guess, the initial design for the facility itself. What we'd like to do is just take a few minutes to have Dan Rorty, who is the architect with the Samuelson Group, to maybe go through the drawing and just walk you through it to see if there's any questions. But then after that, we can bring it back and either Wayne or I should be able to answer that. So again, what I will do is, Dan, I will unmute you and I will give you the floor. And I'm sharing the, can you unmute yourself or I can do it from here? You have the floor. There you go.
Yes, I can unmute myself. I can work through the drawings you have then, is that correct?
Yes.
Okay.
I have the floor plan up on the screen that you see shared on the thing.
Yep. So, and is my cursor visible on this screen? Is it circling around? Okay.
No, it does not.
Oh, it does not. Okay. So the plan you're looking at is of the historic island dairy and the building portions that are in the grayer color, not dark black or dark gray, but the gray color represents the outline of the building itself. And that's the bulk of this page, center to the right. On the left side, you'll see a square that has darker walls. This is an addition, and the yellow rectangles represent emergency vehicles, approximate sizes of each vehicle. So that's the piece of extra work that's being done, or the piece that adds to the original plan. You probably are familiar that this particular building has an elevated walkout deck from the second floor. That is in the same location as this new garage and is going to be taken apart and recycled, as it creates great restrictions on height of vehicle. We either end up with not enough space for the vehicles we need, or going down below the floor level of the existing building to create enough space if we keep that existing deck, which is tied to the second floor, in place. So through the study process and a lot of input, it was decided to remove that. The other thing the deck did is it limited the shape and function of the garage space. We ended up with a front and back parking instead of a side-by-side parking of the vehicles. With that deck gone, we not only then were able to get the side-by-side arrangement, but also have an optimum size for the rescue bay. As you look at the existing building plan, you could kind of draw a diagonal line from the upper left, where you see a round circle with a couple of little chairs in front of it. It says conference, to the lower right, where it says existing stair and preliminary not for construction. Everything above that line, public lobby, toilet rooms, the existing stair lift, that's basically untouched. There's nothing we're doing there, unless just to the left where we start, there's a door that will infill with some wall and put doors in a different location. Below the diagonal of that line is the EMS and county facilities. And so starting in the upper left, that place we were with the diagonal line, You'll see that circle with the little rectangles. That's the conference room. It's a small conference room, but it still allows public use, county use for public work requirements. Maybe social worker has to meet with somebody, whatever it might be. Just below that, you see listed county office. That space is there to kind of be a landing point for county employees and officials who are here on Washington Island for county business. It would be multiple people using the space, but it does provide a public space that others can come to meet here on the island. Continuing down, and the rest is the EMS facility. The lounge takes advantage of the existing fireplace as one of the elements within the room. Below that, in the down lower left corner, is the lockers area. It also includes a decontamination area in there. Going across the bottom from the lower left corner where the lockers were to the right is an EMS office with 2 workstations, then 2 sleep areas that contain a single bed, though it could be a bunk bed if the county decided that was a different way to handle staffing this in overnight situations. And then if we continue then just up from the last sleeping room, you'll see the shower toilet that will be dedicated to the EMS, and specifically should somebody be required to stay overnight. To the right of that, where it says laundry mechanical, is where we would have a washer and dryer and a sink. And above and to the right of that, which is now the existing building that's really unchanged, that's a mechanical room and storage that's not altered much. If we come back to about the very center, just lower left of center, we saw the lounge there to the extreme left. Existing kitchenette is what's stated in that little rectangle in the middle. And that's a little larger right now. We'd reduce it back to its actual original size. And that helps accommodate the office and sleeping areas below, but also then provides adequate space for an EMS kitchenette. I don't know if there'd be any other specific questions on the first floor plan.
Laura.
Yeah, hi. Looking at this and wanting to separate it out, the lower left,
Laura,
excuse
Laura,
me.
can you use
Oh,
the
I'm
mic?
sorry. Oh, hello, new technology.
There you
Those
go.
other microphones we had really picked up everything. Thank you. Okay, now you can hear me. The lower part of the diagram looks to be all EMS or ES center. That kitchenette, and right to the right of that, there is a door. And it looks to be that there's only one access to that kitchenette, and that's to that lower part. Is there an idea, or has it been evaluated that you may want to have a different entrance to that kitchen so the upper portion and the lower portion can be completely locked and separated from ES, or if there was some other function of county purposes happening in the northern part? This is going to be emergency services, medications, supplies will likely be kept in there. I think it is best that we have it completely if we want to, completely secured off the EMS or ES portion from any other area. So that's just an idea I'm throwing out there. I'm not sure if it was already considered or looked at, or if I'm missing something here, but I'm only seeing this access point at that.
To answer the question fairly, no, that wasn't specifically considered. However, in that kitchen, the space that remains toward the public lobby is not as open as it appears here. You'll notice at the right side, there is a wall there and then a sink below it. That little alcove is for the drinking fountain. What you don't see here to the left is the built-in stack of ovens and microwave. And because of that, the width of that particular opening that would go to the public would not meet ADA. That doesn't mean we couldn't take the ovens out and make some rearrangements in there and so forth. But the expectation was that it'd be the ovens, then the refrigerator, then the stovetop, and then the pass-through window. That'd be reading the left side of that existing kitchen. Balanced with this is that there is a full kitchen on the second floor. It is accessible because of the lift, and it has full capacity. And I believe then perhaps it was never talked about to make it shared here at the public lobby, partly because there was a full kitchen upstairs. again, this is the time to raise this type of question to know if there's something different we should do.
Yeah, so I
So just as follow-up for that too, so the one thing we did discuss is the access to the kitchenette and how we wanted to do that. So the thought process and the way it's designed right now is that the existing kitchenette on the first floor, I guess, would be exclusive or designed to be exclusive for, I guess, ES. Or, you know, county staff would obviously have access to it because they have access to the sleeping quarters, but that, I guess, is more of a private kitchenette. And then the one upstairs, we had actually Jake go up there and look at the kitchenette. We're not looking to do any major design work on it yet right now, but the idea would be is that we're gonna try to make sure that we can use the second floor, whether it's for the future library or meals program, that type of thing. We're looking at that, and we're gonna get some basic programming from that from Dan and his firm, just in terms of how that comes together. But the idea is that the second floor would be, in essence, your possible kitchenette for other public uses or for other programs. So that was the thought process behind that.
This is a suggestion going forward, if Wayne or Aaron, kind of you guys want to really look at that, and the gentleman talking with us right now, just as a universal approach to this as potential future use, that however you want to look at that door putting in, I'm not an architect, but maybe consider doing that you can actually completely shut that off where EMS can be separated, or vice versa, you can shut it off and open a kitchenette to a potential county or public lobby use, even though there is facilities upstairs. So just food for thought. Thanks.
Bob?
Thank you, Mr. Chairman. I appreciate Supervisor Wadachek's comments. My question involves the garage area. I'm wondering if we have plumbing out in the garage to wash trucks. Obviously, they're going to need to be, hosed down, and then possibly, gross decontamination when you first come in, that sort of thing. So I'm wondering if there's plumbing out in the garage, and then, kind of subsequent to that, floor drains. Are there floor drains in the garage? Thank you.
Yes is the answer, and it actually goes just a slight bit beyond that. Because we are in a garage situation, the floor drains then also need to be connected to a holding tank. We don't want to have it go to the sanitary system, so we need a separate tank to handle the contaminated debris that comes off of the trucks after a call, especially in the winter. So yes, wash down trucks, that gets captured in the floor drains, and then the floor drains end up in a location with the holding tank.
Thank you.
Dave Enigal?
In reference to the secondary access to the kitchenette on the first floor, that I would not be in favor of. Those, the space right now is relatively securely locked off by a single door access between the common space and the rest of the EMS area. There is at least one, if not two, openings from that kitchenette into the EMS lobby area, and I certainly would not want our EMS crew interacting at that time when some other event is going on where that kitchen is desired to be opened for the other event. There is a full kitchen sitting upstairs. There's really no logic, besides the ADA, which I also recognized. There's really no logic in putting a second door into that small kitchenette down there that really should be viewed as a glorified employee kitchenette. So it is their area, their space, and they can recognize that it's not going to be dual purpose for some reason. In the future, different story. But as long as it stays as an EMS building, it shouldn't be accessible. That makes me nervous to see yet another opening going into that space. Thank you.
If there's no other questions, I guess what we do is go back to the original motion then, and what we're requesting for approval is to now go out. Well, I guess we'll talk through this, the access to that one more, this is a staff level, if you're okay with that. We'll flush that part out, but I guess right now with these conceptual drawings, we'd be putting these together and then going out for a bid.
If I could, Ken, we're putting this together for your approval to say we should proceed to create drawings to go out for bid, but you would have another checkpoint just before it went out for bid if you so desired.
No.
Okay.
This is authorization for use to do the drawings and actually go out for bid.
Okay.
Bob?
Thank you, Mr. Chair. Also a clarification, was focused on the floor of the garage. Just to clarify, the garage roof then there would be no pedestrian access to the roof, correct? I see a stair and that's just the like emergency or fire exit from the second floor, but it's my understanding that the garage roof will be higher than the current. And so there will be no decking or pedestrian access to the roof, correct?
That is correct. That stair is picking up the secondary exit from the upstairs because we're eliminating the stairs that were in the old observation area. The new roof height, though, will be less than the height of the window sills we put in where the big patio doors were. So the visions out will be very, very similar to what you're used to, just no access to the roof.
Thank you for the clarification.
We're good?
Joel?
I guess I should throw my 2 cents in and say that aesthetically, I think this is beautiful. It is an outstanding rendition of what I hope will take a lot of fear out of people's minds from the public that have been against this from the beginning. I think it looks beautiful. They've done a fantastic job.
Thank you. Anybody else? Any other comment? Voter board. Okay, we will move to the voter board. I'm sorry. Yeah, you've got 20 yes, 1 no. Sorry. Thank you. Okay, we'll move back up to the agenda, resolution 20-21-05, approval of gift, grant, and or donations for the Door County Clerk's Office.
Thank you and goodbye.
I know, we'll go back. You want to explain the clerks? You want to explain it? Go.
I can, sure. I don't have my microphone on. So we were offered, the county was offered or all counties were offered a grant through the Elections Commission in the amount up to $10,000. We could use those funds to cover additional costs associated with the coronavirus and that were spent to prevent, prepare for, and respond to the coronavirus for the 2020 federal election cycle, January 1 through the November election. And we applied for the grant and received the grant in the amount of $9,291.10. We are using that grant money to cover unbudgeted overtime costs as well as unbudgeted costs to purchase election supplies, and mainly that would be absentee envelopes that we provide to the municipalities.
Any questions? If not, we'll go to the voter board.
Sorry.
It is, okay. All right, we'll go back up to the one that I skipped. Resolution 2021-04, supporting increased funding for aging and disability resource centers. Megan.
I'm trying to find the page and I keep skipping past it.
Megan?
Yeah, I said I'm trying to find the page and I keep skipping past it.
Oh, sorry.
Help me out here. Thank you. Good now. All right, wonderful, thank you. I'd like to ask, oh,
I could do a general overview then. Sure, that's fine.
this is a resolution that we discussed for supporting our ADRC. I'm not sure if anybody has any questions at all
Want to add anything?
on it, or if Joe wants to give any input.
I can take a shot at it, and then Joe's in the back if you have more
Sure.
questions, but
Yeah.
just a short version, it's
Take it off.
this, the way the state does their funding and allocations. They were looking at how they do some of the formulas for that, and we are giving input back to the state saying that we would like to, I guess, allocate or look at those formulas in terms of the distribution of those dollars. So the first page on page 49 kind of goes through the whereas, explaining how those dollars, I guess, are established. And then on the last one on page 50, then it goes through now therefore be resolved in talking about the funding that's available by the state, and then how, if we provide additional funding to the ADR across the state, how that would be used in terms of allocation of those dollars. So that's what we're looking for. And this would be, again, our standard thing where it's shared with the governor, the secretary, and you can see those listed below.
Any question? Okay. We will go to the voter board. Sorry, my mic keeps cutting off on me. That has passed a vote of 21 yes, 0 nay. We are going to take a 10-minute break. Please be back at 10 to 12. Thank you.